And the results of a new friends and family test to rate patient care at NHS hospitals have proved mostly positive.
Well, more now on that, and joining me are Dr. Johnny Marshall, who's the Director of Policy at the NHS Confederation and a practicing GP, and Dr. Paul Hodgkin, he's Chief Executive of Patient Opinion, a company that has gathered feedback about the NHS for the past 8 years. And I just want to ask you first of all, Dr. Hodgkin, I mean, we've heard, for example, critics of these surveys saying, well, one hospital ward was written off on the basis of one survey being answered, and I think a pretty low return on these surveys generally. So bear in mind this is at an early stage. Are really the findings of this significant at all, do you think?
I think it's a great start. I think it's great that the NHS is showing that it's listening, and it's great that it's asking these questions, but you're right, it is very early. There's a lot of learning needs to happen, and it's not the only way. I mean, we've, at Patient Opinion, had 8 years of listening to patients, telling their stories, and you can imagine that actually you're much more likely to tell the full story if you can write it in your own words and just do a tick box. So I think you need both.
What do you think, Dr. Marshall? I mean, at this stage, is this really significant, this survey?
I think the significance is it marks a new opportunity to listen to patients and use their voice to improve the quality, but it certainly needs to be developed to ensure we really understand what it means. So we already have hospitals that collect live data about feedback, that use that feedback and feed it back to patients so they can see the changes that are making. But it's important, I guess, that we're doing that throughout the NHS. So I think this marks an important step to doing that throughout the NHS.
But I mean, can we say on the basis of this that the small minority of wards which come in for criticism really are worse than the rest of the wards in the country?
I don't think the level of information that we have at the moment allows us to make that sort of comparison because of the different sort of response rates. But it does enable us to start at least looking at the issues of getting patient feedback, how we can improve on that, and how we can use it as a benchmark to demonstrate quality going forward. I mean,
it has to be said, Dr. Hodgkin, that for many healthy people who find themselves in hospital, it is both a bewildering and an unpleasant experience. Sure. You don't want to be in hospital. So can we really make fair judgments, do you think?
Well, I think the questions you asked, would you recommend this? I mean, in lots of situations, of course, you'd never...
I wouldn't recommend anybody go to hospital.
Exactly. So in that sense, the whole concept is slightly flawed. And I think to go back to your question about, does it tell us anything? I think at wards where you've got a very low score, it says, well, maybe you should look harder here and do some work. So I think it is, even at this stage, useful. But in the long run, I think it needs to be much more open, many more ways of collecting people's stories. All the comments that you were talking about in your the free text comments are really useful, really rich data sources, and they should be made freely available. So I think it's a start.
I mean, is it a sensible question to say, would you recommend someone going to this hospital?
Well, I think it's a difficult question to ask when you're in hospital. I think you need to work out when is the right time to ask that question, but also to recognise that it's only one part of feedback that hospitals collect about patient experience and quality. So I think if you sit it in isolation, the danger is it doesn't really tell you the whole picture. If you look at that alongside other bits of information, you might get a better picture.
I mean, obviously things like, were you treated with respect, were you told what was going on, were the doctors and nurses polite? I mean, is that the sort of questions that are being asked, or are people being asked to make, in some sense, as lay figures, a judgment on their treatment?
I think people do make, our experience is that people do make judgment about the things they feel qualified on. They don't feel qualified to say, should I have had this type of hip replacement rather than that hip replacement. But they do know whether they were treated with respect and dignity, and whether the place was clean, and what they felt about their involvement in the decisions. And those are the really important things, which currently this test doesn't capture. It just says, would you recommend it or not? And that's why it needs to be more a wider range of tools used to assess this stuff that really listen to patients.
I mean, it's interesting because I think there was a survey done of people working in hospitals, and they were actually rather more critical. I think it was something like 40% of them said they wouldn't recommend the place where they were working to patients.
I think this sense of ensuring that we're supporting people and patients in understanding what their expectations should be when they're an inpatient on the ward or when they're in an accident in the emergency department is probably a really important point of increasing their understanding of what good quality is. But I think this is just an additional measure, I guess. It's very much looking at their experience and how what they value. What we need to understand is perhaps the messages behind it.
I mean, Dr. Hodgkin, finally, do you think there is a change in people's perception of the NHS? That we know it's a much-loved institution, but after mid-staffs and other reports that perhaps the general public is realising that it needs to be more critical and perhaps less accepting of the treatment it gets.
Yeah, I think you're absolutely right. I think we're in danger. I'm not sure we've gone over a tipping point, but listening to the stories coming in on patient opinion and listening to all the media stuff around, I think there is a real danger that we will go over a tipping point. I think friends and family will help, if anything, to move us back from that, because being honest and transparent, as Tim Kelsey, who leads this programme, is saying, is absolutely important, but it's not enough. Actually, what your experience on the ward needs to change to get good, great care that is dignified and treats you with respect.
OK, I have to leave it there. Thank you both very much.
Thanks very much.
Welcome.